Did you know that high blood pressure, also known as hypertension, affects more than 50 million Americans? Untreated, high blood pressure can lead to strokes, heart attack, heart failure, and kidney failure. With treatment, you can lower your blood pressure and subsequently reduce or even prevent these problems from occurring. What is high blood pressure? Blood pressure is the force of blood pushing against the walls of the blood vessel as the heart pumps. The large blood vessels are like the tube of a garden hose. The small blood vessels are like a nozzle. If the nozzle is kept open, water will flow freely through the hose, and little pressure builds up on the walls of the hose. If the nozzle is clamped down or narrowed, however, pressure builds up against the walls of the hose. If the pressure builds up against inside blood vessels, then the heart must work harder to pump the blood through the vessels. What measurements define high blood pressure? A normal blood pressure is 120/80 or less. The first number represents the systolic pressure, and the second number represents the diastolic pressure. Borderline high blood pressure, which is also known as prehypertension, is between 120/139/80 to 89. If your blood pressure is 140/90 or higher on more than a couple of occasions, you have hypertension. To measure your blood pressure, you can buy a small home-based blood pressure machine, you can have your physician check it, or some pharmacies and even Walmart might have a blood pressure machine that you can use. Here are some simple lifestyle adjustments you can do to help with high blood pressure. First, if you are overweight, change your diet. Weight loss in obese or overweight Americans is the most effective non-drug method for lowering blood pressure. This will also help with diabetes and high cholesterol. Be cautious on how you lose weight though, and you may want to consult your physician on the best weight loss program. Second, always exercise regularly. Just walking 30 to 45 minutes 3 to 4 times a week will help reduce high blood pressure and can help with losing weight. Third, reduce your salt intake. If you avoid foods with 150 milligrams of salt, this will go a long way in your overall reduction of blood pressure. Foods such as pretzels, pickles, canned soups, processed foods, and tomato juice are particularly high in salt. Last, moderate your alcohol consumption. A glass of wine, beer, or even a cocktail is okay, but please limit this to 1 to 2 alcoholic beverages per day. If you or a family member have alcohol-related diseases, I would recommend staying away from alcohol altogether. If you're put on a medication for high blood pressure, take it and take it consistently until your physician advises you that you no longer need it. Keep in mind that people with high blood pressure can have it controlled. I hope that I've been able to help you better understand hypertension and, more importantly, how to manage it and live life at your best.